Hey, this is Dr. Goodwin, your cardiology concierge, coming back to you again. Glad to see you guys again. Please, if you want more content like this, please hit like or subscribe button. That's somewhere floating around here. I can never catch it. Based on some of the questions that we've been getting coming in, I've been asked to talk about what kinds of things can you see very early on with heart disease in dogs. It's a fair question. If it's very early, then oftentimes you won't see anything at all. Dogs are amazingly capable of handling a lot. They don't start to show you signs until they're starting to get to a point where things are really starting to wear on them. When that does happen, what do they show us? Number one, and this is kind of a tough one to swallow, but they look like they're getting older. We're like, yeah, well, my dog is older. My dog is 11, and my dog's 12, my dog's 13. So yeah, they're getting older. I expect them to slow down. Absolutely. It's just cardiac disease also can cause them to slow down. So if they're slowing down and they have a heart murmur, like we talked about in one of the previous videos that you can watch right here, or there, some of those spaces. If they have a heart murmur as well, then we may want to check and see if their heart is starting to change enough that it's creating them an issue. If they're just getting older, then fine, they're just getting older. But oftentimes we'll see dogs who look like they're getting older, but what they're really showing you is signs of their heart making them tired. The one thing that's nice about cardiac disease is it's typically not painful. It just makes you tired. You're fatigued. And dogs that are fatigued, instead of jumping up to run and go see at the door, they might just raise their head and say, oh, you're back. Good to see you, and put their head back down. So little subtle things like that you can see. Another one that we'll see is a decrease in their ability to exercise as much as they used to. If you have a really active dog that you take a mile walk or a 2-mile walk with or 5-mile walk with, whatever one it is, and you're normally doing this, and all of a sudden you're walking and your dog was leading you on the leash the halfway through, and then they start slowing down and they're at your side, and then they gradually are walking behind you. That would make you say, wait a minute, why are you slowing down? Why am I beating you in this race? You got 4 legs, I got 2. That shouldn't happen. So if that's starting to happen, that should be a sign that you may want to check and see if the heart's giving issue. Another big one that we'll see early on is that if the heart is actually starting to get larger in the chest, often you can get a cough, but it'll be a very specific cough. It'll only happen when the dogs are laying down on the ground or they're getting picked up by their chest. Why is that? Well, when you lay down and that force of the ground presses up into the chest, it lifts the heart up and makes it press into the windpipe if the heart's enlarged. And if that's the case, that can create a tickle in the back of the throat and make the dogs cough. But again, it won't be a cough when getting up or a cough when running around or a cough when drinking water or excited, but this will be the cough that happens pretty much every time they're laying down, especially for extended periods of time. If you want more content like this, please hit the like or subscribe button, and can't wait to see you next time.